Hi, my name is Todd Brown and I want to welcome you to the special presentation of Back Pain Relief Secrets. I'll be your host for the next 20 minutes. What you're about to discover on this DVD is how to quickly experience freedom from your back pain and finally live life without an aching back. Please keep in mind, back pain is commonly mistreated by a lot of physicians and is a potentially dangerous condition millions of Americans suffer from every year. Ineffective and unsuccessful treatment of back pain can quickly lead to decreased levels of activity, chronic discomfort, and overall deterioration of one's health and quality of life, and even financial hardships. Thankfully, with this DVD, you'll never have to experience any of that. Instead, in the next 20 minutes, you're going to discover a number of the secrets to quickly and permanently eliminating your back pain, naturally, including why going to your family doctor for your back pain is one of the most dangerous things you can do. How taking pain medications may provide short-term relief but will cost you your long-term health. The scary and shocking statistics about people who go through low back surgery. What you can do right now to free yourself of your nagging back pain. And best of all, at the end of this DVD, you'll discover the ultimate solution that will not only relieve and heal your back pain in a completely natural way without the risk of any nasty side effects, but will let you experience that recovery with no expense. Sounds pretty amazing, doesn't it? Well, it is. And you're about to find out why. Let me ask you, do you ever find yourself asking any of these questions? Is my back ever going to feel good again? What will my life be like if my pain never goes away? What if my back never gets better and only gets worse? Well, it's completely natural and normal to find yourself asking these types of questions when you've suffered an accident or injury or suffer from chronic back pain. And it's also quite normal for the fear of the answers to leave you feeling somewhat frustrated or even depressed. But it's so important to remember you are not alone in your struggle. According to popular medical journals, 31 million Americans have low back pain at any given time, and 1/3 of all Americans over age 18 had a back problem in the past 5 years severe enough for them to seek professional help. And although the cause of back pain is varied, the dreadful consequences are not. Unlike most other injuries or ailments, due to the severity of its nature, back pain may damage or destroy every aspect of your life. Here's a question to think about. What's the leading cause of missed work time? The answer? Non-specific back pain. It's the #1 culprit for lost time, wages, and productivity. And how's your back pain been affecting your relationships and your personal life? Well, constant pain creates anxiety, stress, and even anger. The inability to do the things you normally enjoy with friends and family, like taking a walk, going to a movie, being intimate with your spouse, or even just enjoying dinner at a restaurant, become a hardship. And forget about doing anything special, like taking a road trip or a nice relaxing vacation. It becomes difficult, if not impossible, to focus on other people's needs, other than your own, when you're in such great pain. Simply put, when you cannot do the things you normally do, perform the work you usually perform, uphold the responsibilities you usually uphold, it's very easy to start feeling bad about who you are. Let me ask you, how has your back pain been affecting your sleep? When you're in pain and under heightened stress, sleep can be your one and only savior, your one opportunity to recoup from the hardship of the day and face the morning anew. However, most back pain sufferers are denied this luxury. Laying flat for an extended period of time can further aggravate the pain. In fact, you might already know yourself. Many back pain sufferers claim nighttime is when they suffer most. Missed work, financial hardships, a deteriorated personal life, poor self-image, and a lack of sleep, it's no wonder that back pain sufferers become easy victims of depression. The combination of all these difficulties can easily make anyone feel as if their life is falling apart. Most depressing of all is the fear of, what if your back pain never gets better? What if your pain only gets worse? Well, Whether you've only just begun to experience back pain or you've been suffering for years, chances are you wouldn't be watching this DVD if your condition was not impacting your life to some degree. Well, at this point, you may have already tried getting some relief from over-the-counter painkillers or anti-inflammatories, or maybe you've tried regular hot baths or even massage. The bottom line is you're probably still in pain and you want a solution. Maybe you're considering going to a doctor, or maybe you've already been to see a doctor. Well, here's a very important word of warning for you. Before you step foot into your doctor's office again, or for the first time, it's critical you hear the truth about the allopathic medical road of treatment for back pain. You may be shocked and possibly even outraged by what you're about to hear. But please remember, please understand, these are not the opinions of the creators of this DVD, but the publicly documented findings of independent scientific studies and medical organizations. Simply stated, conventional medical doctors are trained to treat your aches, pains, and sicknesses in generally one of two ways: through the prescription of various medications, or in some serious cases, through surgery. It's no big secret. However, did you know medical doctors do not receive any training specifically for treating back pain? In fact, let's take a close look at what conventional medicine has to offer you if you choose to visit your medical doctor in hopes of finding back pain relief. Did you know each year in the United States an estimated 140,000 people die from drug-related reactions they get after taking a prescription medication prescribed by their doctor? It's estimated that up to 98,000 Americans die yearly from medical errors. For instance, a doctor accidentally making the wrong incision, a nurse administering the wrong medication, and so on. That's almost 250,000 deaths each year in the United States alone due to the adverse effects of surgery and drug treatment. It's certainly good reason to start questioning what we learned as kids about running straight to the doctor, right? Well, if you go to the doctor with back pain, unfortunately he or she will have nothing else to do other than reach for their prescription pad and offer you drugs. And you can place your bet your doctor's going to recommend or prescribe one of the following types of medications. 1. Over-the-counter painkillers like Tylenol, Advil, or Motrin. 2. Prescription painkillers like Percocet, Vicodin, or oxycodone. Or 3. Prescription muscle relaxers. Let's first talk about the scary truth about over-the-counter painkillers. While these medications can be fairly safe over the short term, it's only when they are taken in amounts not exceeding the recommended dosage and for a short period of time. The problem is, due to the chronic and severe nature of back pain, it's almost impossible for a doctor to provide you relief while sticking to these usage guidelines. And because most back pain is chronic, it will not go away after a couple of days or a week. In fact, it will never go away until the underlying cause of your pain is remedied. In other words, taking over-the-counter painkillers is a temporary band-aid that will never permanently eliminate your back pain. Now, you might be wondering, what's the big deal about taking a little extra Tylenol for a few weeks or even months? I mean, I can buy it at the supermarket. It can't be that dangerous. Well, a breaking new medical study done confirms the health risks and dangers of over-the-counter painkillers. Ulcers and intestinal damage were only some of the common side effects seen in people using over-the-counter painkillers for too long or in too high of dosages. So, if your doctor tells you to rest your back and just take some Tylenol for the pain, and he advises you to do this for any length of time more than about a week, or if the recommended dosage exceeds the restrictions on the bottle, don't do it. You will undoubtedly damage and possibly even severely injure your stomach. Again, even the manufacturers admit on the bottle's label these medications are not meant to be taken in large dosages for an extended period of time. Regrettably, the majority of the medical community chooses to ignore the risks, and they don't admit the dangers these various medications pose to your health until the damage is already done. There is some good news, though. The FDA is finally beginning to do some studies to find out the risks over-the-counter painkillers pose to chronic pain sufferers like yourself with your back pain. The FDA found when taken for long periods of time, Aleve and Naproxen, two of the most popular over-the-counter painkillers, may actually increase the risk of cardiovascular disease. And we haven't even talked about the potential liver damage that results when taking these drugs for a period of time beyond that indicated on the label. Point being, if you have seen or see a doctor who recommends you take over-the-counter painkillers in any amount or length of time exceeding the FDA advertisement, turn and run. Do you really want to suffer decreased cardiovascular health, ulcers, and a toxic liver in addition to your back pain? I think not. Now, what if instead of recommending over-the-counter painkillers, your doctor chooses to prescribe a narcotic painkiller for your back? These drugs are different from aspirin and Tylenol and whatnot because they are derived from opiates. What does that mean? You guessed it. In addition to the many other health risks, these drugs are highly addictive. You might recognize these substances by their more common names. Perhaps your doctor has already prescribed one of these for your back pain. Percocet, Vicodin, codeine, oxycodone. Do these drugs work? Absolutely, if your definition of working is to provide relief from severe or chronic pain. However, each and every time you take one of these drugs to relieve your back pain, your body develops a greater tolerance. For this class of drug to continue working, you are required to take higher and higher doses. Keep in mind, this class of drug is a derivative of opiate, the same substance used to make heroin. I know it sounds crazy, but it's the truth. Taking these drugs for back pain is a surefire way to dependence and addiction. Not to mention the agony of withdrawal symptoms when you attempt to stop these drugs can be pretty brutal on your body. Whether your doctor prescribes a narcotic or non-narcotic painkiller for your back pain, the critical problem is this. None of these medications actually fix or heal your back. Therefore, as your back pain persists, if you do not seek other help, you must take these drugs in higher and higher dosages to function. In your quest to be free of back pain, you must be careful not to compromise and endanger your short and long-term health. This is critical. Now, some doctors stay away from painkillers with their back pain patients and instead prescribe muscle relaxants. The problem here is that muscle relaxants don't get to the root of the back pain and only force the muscles in the back to loosen up. Meanwhile, the tight muscles are the body's way of protecting a hurting spine. By taking muscle relaxants, you're forcing the body to stop protecting the spine. This is why when most people stop taking muscle relaxants, their back is even more severely damaged and they're in even greater pain than before. This is not something to take lightly. If you choose to seek help from your medical doctor for your back pain, there's one last treatment he or she may prescribe. It's not a drug in the sense that it's a pill, but it is a medication. In fact, it's one of the most frightening treatments of all. Welcome to the world of epidural steroid injections. This is a common choice for treatment of back pain by medical doctors. Here's how it works in a nutshell. In an attempt to reduce back pain and inflammation, pain doctors use an X-ray guided injection of steroids directly into your spine. Does that sound like fun? Does it sound dangerous? Well, the PDR, the guidebook doctors are supposed to follow in prescribing medications, specifically states, quote, suitable sites for intra-articular injection are the knee, ankle, wrist, elbow, shoulder, phalangeal, and hip joints. Joints not suitable for injection are those that are anatomically inaccessible, such as the spinal joints, unquote. Again, joints not suitable for injection include spinal joints. If you're bold enough to ask your doctor whether or not the PDR approves of the large needle he wants to stick into your spine to help your back pain, don't expect a straight answer. If your doctor admits anything at all, he'll probably say the PDR is just being overly cautious and he's injected hundreds of spine without any complaints. Well, ask him why it is then that epidural steroid injections have been banned in several countries around the world. You don't have to be a brain surgeon to realize injecting a syringe directly into your spine is not a safe or natural way to relieve back pain. An epidural injection delivers steroids directly into the very thin epidural space in the spine via a very long needle. And according to studies, blind needle injection, even by skilled and experienced professionals, has been found to be inaccurate in 25 to 30% of all cases. That means if a pain doctor wants to give you just a single epidural injection, just to quote, see if it helps your back pain, you have a 1 in 4 chance of becoming a victim of an inaccurate injection. And that's if he's a skilled and experienced professional. So, what's the big deal about haphazard, inaccurate injections to your spine, you might be wondering? Well, just ask Dennis Capolongo. A nagging hip pain prompted Dennis to visit his medical doctor. After receiving just 2 epidural injections, he suffered 2 trips to the hospital, was hospitalized, and suffered non-stop back pain. That's not even the real tragedy. Dennis developed arachnoiditis, a pain disorder caused by the inflammation of the arachnoid. That's one of the membranes that can easily be damaged as a result of blind epidural injections. He can no longer work or do anything he used to because of his condition. He describes the condition as, quote, sheer, hopeless hell. And there is no cure. Dennis invests the little strength he has now to warn unknowing patients like yourself of the horrific dangers of epidural injections. So, does this form of treatment sound like something you should gamble on? I think not. Now, let's just recap everything you've learned so far about the only drugs your doctor can prescribe for your back pain. Over-the-counter painkillers, which have been proven to erode the stomach, cause ulcers, and turn your liver toxic. Prescription painkillers, which also inevitably lead to dependence and addiction. Muscle relaxants, which will mask your pain while you do even greater damage to your back. And finally, the epidural spinal injections, which can leave you terminally sick, paralyzed, or worse. I hope you see that none of these are a wise choice to eliminate your back pain. With drugs out of the question, there is one more form of treatment your doctor may recommend for you to relieve your back pain: surgery. Now, before you jump at the chance to go under the knife, listen to what Dr. Arthur H. White, internationally renowned orthopedic spine surgeon and recognized leader in the field of spine surgery and rehabilitation, sadly admitted. Quote, exploratory surgery to search for the cause of a patient's pain is useless. You don't operate on a chronic patient unless the pain is intolerable, unless you know for sure that the pain is generated by a specific malfunction in the back and that surgery has been shown to correct this particular problem. Unquote. Again, for a surgeon to operate without knowing the exact cause of your back pain is useless. Yet, there's a good possibility this will happen to you, according to Dr. White. Dr. White reveals, quote, I make my living on cleaning up the messes of other surgeons who have operated prematurely with inadequate diagnosis and inadequate training, unquote. Not only is back surgery a potentially huge cost for you, but it may be completely unnecessary and ineffective. According to William Abdu, an associate professor and director of the Spine Center at Dartmouth College in Hanover, New Hampshire, quote, spine patients are nowhere near normal when they walk in the door. Their spinal condition and other problems are so burdensome they don't function well. After back surgery, people don't return to normal and still have the psychological and social problems they had before back surgery. Unquote. Repeat, if your doctor or surgeon even hints at the fact that you'll be, quote, good as new, don't be fooled. Dr. Abdu regrettably admits, quote, we can't make these people normal, that is, healthy with full function, and we shouldn't think we can. If any doctor is telling you this, whether they admit it or not, they are telling you a lie. Unquote. Again, whether it's your surgeon, family doctor, or even friend or family member, Dr. Abdu, director of the Spine Center at Dartmouth, says it's a lie. If you happen to be a person with long-suffering chronic back pain, surgery will not help you. The Dartmouth professor of medicine discloses the truth when he says, quote, "We're not going to cure back pain by operating on 40-year-old people with 20 years of back pain. We can't cure them by operating on them," unquote. But most unsettling of all is not the surgery itself, but the aftermath of going under the knife. As shared earlier, statistics show that if surgery is required, 3 of every 4 workers will not return to work for up to 4 years because of pain. That means if you simply cannot take your back pain any longer and decide to have surgery, there's a 75% chance you will be out of work for up to 4 years. If you're considering back surgery, there are some serious questions you need to ask yourself. Are you prepared to be unable to return to work for up to 4 years because of pain? Can you afford to be out of work for up to several years? If you walk away with one and only one thing from watching this DVD, and we certainly hope you walk away with much more, understand this. Nobody is questioning how horrible and debilitating your back pain is, and nobody is saying you should have to live with it. However, medications and surgery will not provide you the back pain relief and restoration of your back that you want and need to return to normal life. It's not all that complicated. Medical doctors are not trained to treat your back pain. That's why they just prescribe medications or refer you to other specialists who will either prescribe harsher medications or recommend surgery. The most you can hope for when going to a medical doctor is a little bit of short-term relief. Now, at this point, you might be thinking that it's best to just rest up and hope that your back pain goes away. Maybe that's what you've been trying to do so far. In fact, if your medical doctor is a bit more conservative, he might even have advised you to rest up until your back feels better. Certainly the first step in treating back pain, like most any other injury or ailment, is to rest. Bed rest is a good medication, so as long as it only lasts 2 to 3 days. You see, prolonged bed rest can actually make your back even worse. Dr. Scott Fishman runs the pain management program at the University of California Davis School of Medicine. He reveals that while years ago doctors recommended bed rest to give patients time to heal, that is absolutely not recommended today. Moving is essential in order for the joints in your back to flush out toxins, feed themselves, and begin the healing and regeneration process. So, if you've been thinking about just laying in bed until your back pain goes away, think again. There's a much better chance prolonged rest will make your back even worse. So, here's the million-dollar question. If medication, surgery, and rest cannot help you, what can? What in the world is going to relieve you of your back pain? Well, there's a very, very exciting answer to that question. Let me ask you this, though, first. What if there was a solution that would remedy the cause of your back pain without any risks or nasty side effects and would restore your body to normal health? And what if this back remedy was completely natural and you could begin to experience the relief completely for free? Well, hold on tight as we take a quick trip back in time to uncover a little known and even lesser understood secret about the true path to back pain relief. Dating back thousands of years, early age doctors in ancient Greece, Rome, India, and the Orient studied and practiced relieving pain and restoring health by resetting the alignment of the spine to its natural state. Over the centuries, with the advancement of technology and modern medicine, this method of healing the body has continued to evolve and advance. Yet, it remains grounded on the same ancient wisdom that if you heal the spine, you can heal the body. Unlike modern medicine with its constant discontinuation of surgical procedures once thought to be safe and recall medications now known to actually harm you, this healing practice has absolutely withstood the test of time. It remains the only way to relieve your back pain and restore your health naturally, without any medications, surgery, or risk of nasty side effects. The relief and remedy you seek can only be found in the little known and commonly misunderstood world of chiropractic care. If you have heard about chiropractic before, it's a good bet what you've heard is false or inaccurate. Most of the talk about chiropractic care is based on hearsay or senseless jokes about how they crack and snap your spine. Well, this couldn't be any further from the truth. You see, the word chiropractic is of Greek origin and simply means treatment by hand. While modern medicine is fraught with nightmarish tales of surgeries gone wrong and untested drugs which get recalled only after the damage is done, chiropractic care is a successful drug-free, hands-on treatment for back pain that has persisted for over 5,000 years. Chiropractic healthcare is a form of medical care which emphasizes the natural recuperative power of your body to heal itself without drugs or surgery. It does so by focusing on the relationship between the spine and your nervous system. Since your nervous system controls all of your body's organs and tissues, a well-functioning, clear communicating nervous system allows your body to properly recover from injuries causing pain, like your back pain. In other words, chiropractic care will allow your body to naturally recover from the root cause of your back pain and will allow you to finally feel good. Now, you may have avoided going to a chiropractor in the past because of something you heard from someone you know. These are what we call the chiropractic myths. Let's quickly cover them. Myth number 1, chiropractors are not real doctors. Not only are they real doctors, but it actually takes 7 years of school in a curriculum very similar to a medical doctor's training to complete their schooling. And in order to earn their license to practice, chiropractors must then successfully pass a state and national board examination in the very same way MDs are required to. Myth number 2, chiropractic treatments hurt. This couldn't be any further from the truth. Most chiropractic patients find chiropractic adjustments very relieving. The mild pop some patients report hearing while being adjusted is just the natural release of gas bubbles that have been trapped in the joint. Same as when somebody cracks their knuckles. The loudness of the sound varies from patient to patient and has very little to no meaning. Myth number 3. Once you go to a chiropractor, you have to keep going forever. Although many choose to continue their chiropractic visits simply because of the incredible health and vitality chiropractic care brings them, some patients experience lifelong benefits from just a few weeks of care. Myth number 4, chiropractic care is not safe. Well, this is the biggest myth of them all and one that is misleading a lot of people. Since chiropractic medicine seeks to restore your body to its natural state of health, unlike allopathic medicine, chiropractic is recognized as one of the safest types of healthcare in the world. It does not include any of the nasty side effects or risks associated with drug therapy or surgery. In comparison to allopathic medicine, which uses drugs and surgery as the core form of treatment for back pain, chiropractic presents far less risk. This is why chiropractors enjoy the lowest malpractice rates in the entire field of medicine. Even the insurance companies have been forced to admit there is no safer care for you and your back pain than chiropractic care. Now, you may already know someone who's experienced the life-changing relief of chiropractic care. You also may know someone who has gone for a single chiropractic treatment and claimed it didn't work. Well, here's the sad truth. In today's fast food society, most people opt for the convenience of popping a pill rather than getting the treatment they need to be permanently healed so they can experience long-term back pain relief. Many give chiropractic a try, but are simply too stubborn and depressed to believe their pain will ever be relieved without drugs or surgery. Still, others are so reluctant to try something new that doesn't stick to what the medical doctors have told them that they delay getting help so long that by the time they arrive at the chiropractor, their condition is virtually untreatable. Regrettably, it is not uncommon for other back pain sufferers to find themselves thinking or saying these exact things about chiropractic care because they simply do not understand it. You might have had very similar opinions before watching this DVD. But now you've taken the time to get educated and informed about the secret of back pain relief. and that is quite admirable. You now know the truth about the commonly accepted but highly ineffective and dangerous back pain treatments medical doctors will offer you versus the completely natural, safe, and highly effective care you're going to receive from a chiropractor. At this point, you are probably eager to discover exactly how chiropractic can help you and your aching back. Or maybe you're hopeful, but still a little hesitant. The great news is there's no need for you to worry or take any risks. Discovering how chiropractic care can help you is fast, easy, and best of all, it's free. We'll get to the free part in a moment. First things first, you might be wondering, do you need a referral from an MD to get a chiropractic treatment? No, you don't need a referral from your family doctor or primary care physician before visiting a chiropractor. In fact, what most people don't know is that federal and state regulations view chiropractors as a first contact physician. In other words, they are primary care physicians. You might also be thinking, but isn't chiropractic care expensive? Well, the answer is no. The majority of all insured American workers have coverage for chiropractic care, and that percentage is increasing regularly. In addition, most doctors offer affordable payment plans to accommodate those who are not covered. If you happen to have to pay out of pocket, you can rest assured you'll still be saving money over the alternative. But we want to make it as easy as possible for you to experience the secret of back pain relief with chiropractic. Inside the package that came with this DVD, you'll find a written letter inviting you to receive a chiropractic back pain relief consultation absolutely free of charge with no strings attached. We don't think your pain is in your head or that you're exaggerating. And we definitely don't think back pain is something you need to learn to live with. No way. That's why we want to give you the opportunity to quickly and easily discover how you can experience the back pain relief you desire with chiropractic care. However, there is one essential requirement you must meet. You must have an open mind. We're more than happy to answer all of your questions that you want to ask when you visit with us. That's what educated people like yourself do, and that's why we created this DVD for you. However, at the end of the day, you must be prepared to give chiropractic care a real chance, to listen to the guidance and wisdom of your chiropractic doctor. Without an open mind and a willingness to comply, chiropractic care cannot help you. You're now faced with a choice. You can choose to continue suffering with your back pain, to continue suffering the negative impact of back pain on your relationships, the added financial stress, and possibly lost time on the job. To listen to well-meaning but misguided medical doctors who want to provide you momentary relief from back pain with dangerous medications, jeopardizing your long-term health. To follow your surgeon into the OR for back surgery and permanently risk your health and your life as you go under the knife. And to listen to your supportive friends and family who mean well, who have also unfortunately been lied to about painkillers and surgery being a cure-all solution. Or you can contact our office right now. Tell us you want to take advantage of your free back pain relief consultation. During your visit, you'll discover exactly how you can begin experience the permanent pain relief you so desire and how you can return to your normal life. There's absolutely no risk or obligation to you. You might be wondering why we would take time out of our busy schedules to see someone like yourself and not charge you a dime. Simply stated, we absolutely believe wholeheartedly in the pain relief we can provide you, and we're confident after meeting us and experiencing it for yourself, you'll believe it too. Take a look at the letter that came with your DVD and give us a call right now. Just say you're calling for your free back pain relief consultation and we'll take care of the rest. The only thing you have to do is prepare yourself to experience the true secret of back pain relief and start making plans for what you'll do when you're finally free of your back pain forever. Don't wait until your back pain gets worse. Call now. The secret to your back pain relief is waiting.